My name is Scout Hurd. I'm from Brookings, South Dakota. I'm a pharmacist and assistant professor of pharmacy practice at the College of Pharmacy at South Dakota State University. So it entailed 2 separate treatments, a couple weeks apart. You go in, Tanya puts on these fancy goggles and she goes through and kind of, lasers the area that is red. And if there's any little blood vessels there, which is common with rosacea, helps kind of diminish that redness. And it does look a little rough a day or two after, but after that, it really not only gets rid of the redness, but I feel like my cheeks look a lot smoother too. After having the laser treatment to kind of help with the redness that I have with rosacea, it just really boosted my confidence in going out in public without makeup. I wasn't self-conscious about that redness on my cheeks. I could just put lotion on my face, maybe a little eyeliner, and I felt comfortable doing so. It kind of changed my perception almost too on makeup because yes, I can wear makeup, but I don't have to. And that was kind of pretty significant in my life for sure. Rosacea does have a potential to come back. I have not had any redness come back, but I guess Tanya did go through those aspects with me that this might not be a permanent solution, but at least we could try it and see, and then at least I know the treatment works, so if I do need more treatments down the road, that's what I would go to. The 2 times that I've received laser, I think the first time it was scary. I was probably pretty tensed up. Tanya does give you a stress ball. She talks you through it. Nothing is a surprise. She's very good at letting you know what she's doing, how she's doing it. It does feel like a little snap. Or if you took a tiny rubber band and maybe snapped it against the area. But I think the part that probably surprised me the most was the flash of light when it gets done. And even with the goggles on, it still is kind of surprising when you see that burst of light when it's happening. But you just kind of get used to it as she goes. I would say it's probably less painful than Botox, honestly. And I thought it was going to be a lot more intensive. So I'm glad that Tanya convinced me to at least try it and do it because, I was worried about how painful is this gonna be? Are there gonna be any long-lasting effects? Am I gonna have spots on my face, right? Because there's the laser coming to it and touching the skin, and I didn't have any of that. I think the one thing that I love about Tanya is the fact that just because I'm a pharmacist, she doesn't assume that I know everything about aesthetic medicine, and she still takes the time to, go over what maybe possible side effects I could experience after receiving treatments. And I guess I feel that comfort too of if I'm getting a treatment, especially too when I got the laser treatment, that I am in a healthcare facility. So if something were to maybe not go well, or if I was to react not in a positive way, what better place to be than Brookings health system in the hospital? So I knew I could, get help and treatment right away. And Tanya's a nurse practitioner, so she would be able to help and treat me right away too. So I just found comfort in that as well.